So actually one of the first cases that I saw as a student way back in the day was a case of chronic fatigue, fibromyalgia. And back then at that time, it was like an in vogue diagnosis as a throwaway, meaning like if they didn't know what was going on, you kind of got that diagnosis and everybody just kind of looked at it like, yeah, it's all in your head. So fast forwarding to today, that diagnosis still exists and it still kind of has that connotation to it, and it overlaps with other diagnoses that also kind of have that same feel where people kind of tell you it's all in your head. The part about it that I think is really important is this overlap that occurs when we look at MRI volume studies. We can see that people that have ME/CFS, myalgia encephalitis, and the chronic fatigue syndrome, and that kind of gets melded into fibro in a weird way. But when we look at those people, when we look at their brain imaged on an MRI, you can actually see that there's a density change in areas of the brainstem that doesn't occur in people that are generally normal. It's really profound indicator of how these syndromes overlap with what we see in dysautonomia, but they overlap through the brain, even though a lot of what people experience is like a generalized fatigue or muscle pain or things that don't feel like they're brain-oriented things, but they actually trace back to having problems that are relative to the brain, which is why we focus so hard on attacking those areas as the problem areas to try to dig people out of those scenarios.